a ride is out of the question.
Down with this sort of thing. Careful now. The nation holds its breath. Yes!
Hello and welcome to another episode of Friends in Low Places, the podcast hosted by four middle-aged men who are at that stage in life when the sound of someone putting on rubber gloves can only mean one thing, and it's not doing the dishes or even cleaning the oven. Gentlemen, how are we doing?
Hi Sean, how are you? How
Hey,
are
Sean.
things?
Yeah,
Looking forward
good.
to this, yeah.
It took me a while to come up with that one. Now, in today's episode, we're going to have a little competition amongst ourselves. But winning this competition, it will not bring glory. It'll probably bring the opposite, more of a scorn factor than anything. Yes, today we are going to do the Great Irish Male Checkup Avoidance Championship. And we're finding out which of us is officially the worst at looking after himself. I already have some bets I've made. I think we might have a favourite, but I'm not going to tell you which one. But so the run of the show today will be, we'll kick off with a general discussion. So I'll just lash out a statement and then we discuss that. And then Niall, you will guide us through what we would call the Great Excuse Championship. After that, we shall put together a Friends in Low Places top 10 things that men avoid doing. And then after that, Mike, you will walk us through the Irish male health system. Looking forward to hearing that one. And then we'll have a kind of a Midlife Man NCT test. So where we'll have some a list of different types of checkups and what we would recommend young men of our age should get checked out. And then we will finish up with a little wee quiz called the Good, the Bad and the Ugly, where you guys have to guess what your partners think of how you handle your physical health at
That'll be
this time in
interesting.
your lives.
Okay.
A few surprises,
I'm looking forward to that.
some things not so surprising, but there were one or two that made me laugh out loud. So I hope we'll do the same for the listeners.
Probably worth mentioning, Sean, that none of us are medical professionals here, so anything that comes across approaching medical advice, I wouldn't pay too much attention.
This,
100%. Yeah, 100%. We are not giving any medical advice in this show.
So if you have a problem, go see a doctor
Exactly.
or a qualified professional.
Or speak to your partner and get them to do it.
Speak to your partner, they normally know it all. Go on.
All right. Okay. So we're going to kick off. What is the longest thing that you've ignored that you know you've kind of should have got checked out? What is the longest thing? I can kick off. So I've had tinnitus in my ear since last March, and it took me probably close to a year before I actually got it checked.
That's pretty good. That was very good, Sean.
Impressive in all the wrong ways, Johnny, but well done.
Exactly. I just kept telling myself it would go away.
Go away. Okay.
I once had a lump on my neck years ago. I say it was 4 or 5 years before I went to get it looked at.
Wow.
And lucky enough,
Jesus.
it was a cyst. I had to get it removed, but sure, I thought it was terminal, of course. But that's why I get white coat syndrome the minute I walk into a doctor, you know.
And
But,
did you not consider like 2 or 3 years into it, Aaron, that it hadn't quite killed you yet? So chances are it
Well,
was
I
probably
thought-
okay.
I thought it might be good, and I kind of got attached to it, really. But sure, look, it's gone now. So, yeah, it worked out fine in the end. So that's pretty bad, isn't it? In fairness.
That's true. I think we're gradually getting worse. Let's see who can do better than that. Mike.
Yeah, I'm same as yourself, Sean. I've tinnitus, but I'm just very, very slow to go and get out and done about it.
So you haven't spoken to someone about it yet, Mike, have you?
I have actually, yeah, a bit to the GP, but I don't know. The GP's here nearly kind of going, yeah, it's just something you're going to have to live with. And I kind of going, well, you know, let's go see an EMT or whatever and get that official done. I've had an ear test and everything done. I do have a reduction or a slight hearing loss in my left ear, which is the ear that I have tinnitus in.
I'm sorry now, lads. Basically, so what is
It's
it
just an old
basically? Can you
nation.
explain it?
So
It's just
tinnitus,
constant buzzing.
it's a ringing in your ear, or it can be kind of a
Hissing.
other type of noise, and it's either got to do with what's it called? What's the nerve?
Some nerve in there.
Vargus, I think it's called. that can either be clogged up and then they can drain that, or else it's coming from the brain.
Okay, right.
So I got mine checked, and my GP said pretty much the same as you, Mike. But then she recommended a really good ear doctor, and so I made an appointment for that. And the one who was supposed to see me wasn't there, so it was her colleague, and he sat me down. We did a hearing test, and then he goes, "Yeah, the hearing is a little bit reduced in the ear, but otherwise it's fine. But you'll need to go to this other place and we'll do some more tests." And I said fine, and I made an appointment, and then the day before I was supposed to go, I got COVID. And so I called them up and said, I can't go. They went, oh, yeah, well, okay, you can call back again later to make another appointment. And I still haven't called back to make the new appointment yet.
Nothing to be ashamed of.
Niall.
Yeah, so I suppose I need to qualify this by saying,
Everything.
so I have a simple kind of a qualification for seeing a doctor. I don't like to go with one symptom.
I remember you saying that. Yeah.
So I generally like to have 2 or 3 things when I visit a doctor, which isn't ideal because I have to wait a long time for the 2 or the 3 things. So I think once maybe. But basically, long story short, I'm living in Dublin now 20 plus years. So last year I eventually had to go see a doctor, but as it turns out, I didn't have a doctor in Dublin. So in other words, I'd been in Dublin for 20 years and I'd never actually seen a doctor. And I don't know how it is in Belgium, Sean, but to try and get a doctor in Dublin is difficult
So, yeah.
nowadays. So eventually Aislinn's doctor agreed to see me on the basis that I couldn't locate a doctor in Dublin. So I suppose that would be kind of my general thing on it, yeah.
Yeah, over here, it's quite hard to get onto a doctor's list of patients. Like we were like family doctor. There was a cabinet, and they closed down. There's 2 doctors, and then they split, and then so they had like, I suppose, a couple of 100 patients without the general GP, and then there was the rush on in the region. So, and we were super lucky to get into one place. But you will often see when you make an appointment, either online or when you call, there'll be a warning message saying Doctor are not taking on any more patients. It's quite difficult. I mean, yeah, if you're just arriving into the area and stuff like that, I don't know how to do it. Luxembourg is quite good though. Luxembourg is quite good. Belgium a little bit different. Okay,
We're spoiled in Limerick, so I've technically 2 doctors. The GP that I go to for bigger things like getting my tinnitus looked at. But if I've the man flu and I reckon it's going to kill me this time, I'll just go to the drop-in clinic beside the regional. So you can just rock up there. You don't have to be registered or anything like that. And you can just get an appointment, see a doctor. It's actually they're quite good, to be fair.
Okay.
They seem to be popping up all around the place as well.
Interesting. We don't have those things over here in Belgium. Drop in, check in clinic. Okay, very good. Niall, the Great Excuse Championship. What are men using as excuses not to get shit done?
Well, I suppose we're the only men here, so I suppose we should maybe consider from our point of view or what excuses do we typically use. So as I said, typically if Aisling puts pressure on me to go see a doctor, I generally tell her to be patient and wait till I have 2 or 3 more things wrong with me before I go and see. But what are the types of excuses that you guys have used in the past when it comes to seeing some type of medical professional, doctors or otherwise? Yourself, Aaron?
Well, obviously there's Dr. Google, which isn't always a good idea. Sometimes just go down a rabbit hole, but look, often that I'll ask a friend, has he had it before? How long was it before it got worse? And I'll do it next week.
You've never asked me that, Aaron. I feel kind of left out if I'm being
he hasn't
honest.
asked me either. So.
Does that leave me?
It
Does
could
that
be
leave me?
dangerous, some of the stuff I'll be asking you. Go on. Jesus. Yeah, pretty much. We've a big list of stuff there. I mean, we've all done it, haven't we? So just
Yourself, Mike?
Yeah, I think it's the usual. I'll be grand until I'm not grand. I tend to put these things off and say, sure, I'm too busy. I'll do it next week. And then it's either worse or getting better, one or the other. But yeah, generally for me, it's just procrastination about it.
I have Specsavers haunting me for an eye test at the moment. They're sending me emails and texts every bloody week now at this stage. What about yourself, Shawnee? What are your top excuses?
Mine are usually, it's tolerable, so I don't have to see anybody about it. I might have a pain somewhere or something's irritating or whatever the fuck, and I go, it's annoying, but it's not worth making an appointment to go see someone about until I can't walk or something like that, So
The bed.
yeah, exactly. So I usually that I like. Oh yeah, I'm a bit like Mike. Maybe it will clear itself up. I'm a great believer in self healing.
Well, sometimes it does, like if it's only a wart or something, but sure, if it's more serious, I don't know.
Well, you can get over the counter medication for the likes of warts and so on, don't you?
Yeah.
Yeah, I had a couple of warts there, not last year, the year before, and between over the counter medication, and then I cut the rest of them off, but they're gone, they didn't come back. So
Nettles are supposed to be good for warts.
nettles,
Yeah. That's what we were
Well-
told when we were kids. More lies. Turn out.
I didn't know that.
Well, they sting the fucking hand off in the first place, but you look.
All right, Shawnee. So
Yeah.
that's a kind of a general, I suppose, flavour of some of the excuses at least we use, and I'm assuming other men use. And it's probably not exclusively men, in fairness, but I think we're probably slightly more notorious, and probably Irish men. I'm wondering if there's a difference between Irish men and European men or non-Irish men, Shawnee.
I was thinking about that. I figure you'd ask me that question. I don't know. I think over here they're probably a bit better at it. I mean, there's a really good health system over here, particularly in Luxembourg. It's quite good. So it's I think when the facilities are there, you probably might have more of a tendency to actually use them and go there. In Belgium, it's pretty okay as well. I would say most of my friends over here who are our age are pretty good at getting themselves checked up on a regular basis. Plus, there's kind of always incentives, like if you do your annual dentist thing, then you get reimbursed if you do it within the year, and so on and so forth, and the doctor as well. Like so, it's that
Back to the
kind of,
dentist for tax purposes.
it's true. It's true. So and your social security, you get money back, but you have to do it within the 12 months. So things like
So
that.
we're gonna attempt to build a top 10 of things men avoid, Shawnee. Yeah.
Yeah, exactly. So we've all thought about this, and I've come up with 5 topics each of what we think men in our age avoid getting checked or doing. So, Mike, what's your top 5?
The one I'm putting off as I'm hitting for the big 5-0 is the GP visit where I have to go and talk about prostate checks, because that's a problem in my family. And I suppose it's one of those things that's going to, I think Billy Connolly famously said one time, when you turn a certain age, the doctor turns from being interested in your front bits to now being interested in your back bits. So I'm putting off that conversation with my GP for a while yet. Mental health as well. I think, we've spoken a few times now on podcasts about different things of mental health. I think people definitely avoid that conversation or even broaching that subject in some way, shape or form. I physio down, but actually I went to Magic Hands Jimmy this year. I don't know, have you seen him on his big following on Instagram? He's based in Dublin. He's a chiropractor, but highly recommend it. Make every bone in your body creak or crick. That was worth going for, but it's something that I put off. Physio visits, I don't know. I always feel worse after them.
You do it for a while.
I suppose getting
Physios and chiropractors, different approximate professions, though, Mike, as far as I know.
Yeah. I suppose physios wouldn't be a fan of them.
Yeah, but if you're
Similar,
going
but-
to physio, it means you have something fairly serious to get fixed.
After injury, yeah.
Yeah, something reoccurring, like it's kind of after surgery or something reoccurring, I suppose. And that was my forte, actually, getting a reoccurring pain or reoccurring issue checked. If if your warts keep coming back, Niall, you should be going to get them tested, I suppose. You know,
I died to ask where
They're-
these warts
They're
appear.
piles, they're piles, Niall, they're piles.
I don't know if they were on my feet.
yeah.
Okay.
On your feet, unusual place to get 'em.
Bunions.
Sleep
Is that what
problems as
they're
well. Sleep apnea. I have a bit of sleep apnea. It's not something I'm rushing out to get fixed, because I think the only fix again in Ireland for it is a CPAP machine, or probably should just go and lose a bit more weight and do a bit more exercise.
Cheers, micro fit out, yeah, but
That's sort of my top 5.
What's your top 5? Before we move on.
Yeah, too close.
There you are. Because.
far too close.
Okay, Aaron, what's your top 5 things?
Well, my top 5 obviously is the first one, GP appointments, going for the yearly checkup. It's yeah, I did it last year, but it was about 3 years before that. Obviously, the dentist is a big phobia for me. So I went about 2 years ago. I got a cleaning, and he told me to come back next week, and I haven't been back. Just when I get into that chair and I hear that drill, I don't know, something must happen to me as a kid, but it just I
Did
really
you
have to
actually
try.
make an appointment to come back? As in, you just
I
didn't
mean,
show up?
He's only down the road. He knows me, but
He knew when he made the appointment. He knew chances are I'm not going to see Aaron for another few years.
yeah, I know I'll have to get my ass in gear and get that done, because I don't know what happened to me as a kid, but Mike didn't go out to Claheen or something for the dentist.
It's the one thing actually I'm pretty good at. I had braces when I was young, so I'm kind of
Yeah, I remember that.
happy enough to go to the dentist on a regular basis.
No, I'll have to. Another one is blood tests, obviously, because I've been looking up too much stuff on Google. So, but I know they do that with your regular GP visit. But I think I generally have kind of white coat syndrome, but I'm getting a bit better, lads. You know, it's kind of and reading a medical letter correctly, because like I have to read things about 10 times before it goes in properly, because I tend to rearrange stuff. Suzanne texted me yesterday. We were leaving Clonmel. She went for something to eat with Dion because we came home early. So I had got pizza. I'll be back in half an hour. What she actually texted was, "Get Kaylee and yourself some pizza. I won't be back for 2 hours." That's the way my brain works. So anyway, is that 5? I can't remember. It's 4 or 5 anyway. Yeah, so
I think based on the fact both Mike and Aaron had GP visits down, so if we follow that kind of approximate rules of the last few top 10, Shawnee, I think GP visits are there. I'm not sure if Mike had dentists as well, or did you, Mike?
No. He said he was pretty good because he had the braces back in the day. Yeah, Niall?
So doctor visits.
Yeah, well, that's a definite on the list then, isn't it?
Yeah. Cook, and again, I'm actually not too bad in this respect. Talking about their feelings, so I suppose a nod to the last episode to a certain extent. For me, any type of routine appointment, so dentists, eyes, etc., etc., etc. I hope I have the correct terminology here. So chiropodists, they're the people that look at your feet, yeah?
yeah.
Okay, that's what I was
Yeah,
thinking.
so when I had the warts, Ashing, I was like, I to go to someone who's a doctor on feet and pay them to look at my feet, I couldn't. I was like, I'll just do it myself. I just couldn't get over that. If they did feet and hands and head or something, I'd be okay. But I was like, no, I can't. It's not, my feet aren't worth it. You know what I mean? And this is one for me. So I've had recurring piles for about 2 or 3 years now. And I was listening to an interview on the radio there. It's about 2 or 3 weeks ago. And seemingly piles affect men more than they do women, and men are really bad to get it seen. But again, I just can't go into it. And it's not even the embarrassment of it. It's just, it doesn't seem like it's significant enough for me to see a doctor about it. But I know that that's also ridiculous.
Do you feel to be wasting their time, is it? Or?
Yeah, yeah. They're not kind of bad enough. You know what I mean?
Mm.
Like they're somewhat uncomfortable every now and then. I treat them with an over-the-counter medication. They're relatively okay, and we rinse and repeat. Whereas I'm probably not treating them properly. Whereas if I actually went and see a doctor, I'm assuming they'd prescribe or do something that would be more longer term. But again, I just can't bring myself to go see a GP. But
Yeah, fair enough.
It's gas, isn't it? Fucking we're all the same. I
Yeah.
think though we have two there though in the sense that Mike had mental health and you have talking about your feelings. So I think we
Yeah.
could put mental health on the
Definitely,
list.
yeah.
Yeah, yeah. And I think we can probably say, I said routine appointments for
Yeah.
me is dentist, but we can say dentist because, like,
Dentist, yeah, okay.
I think sleep problems is important as well, Mike was saying, because let's face it, we all suffer from that at times, don't we?
Yeah, and you had that, Aaron, and I will have that. I do have that on my list as well. Fucking getting your sleep checked out.
so the last time I was at the dentist, I think I got a filling or something, and they said I had 3 more fillings to get. So I said, yeah, no problem, but can I get them all done together? And the dentist wasn't up for that for whatever reason. So again, I like having to go back for one by one filling or whatever. I just can't,
But it's more money for them now, that's it.
yeah. I'd happily have my teeth taken out and get false teeth just for that.
Two big gold ones for the front.
Guys, take note of what Niall is saying for later in the quiz.
Yeah.
Jesus, go on.
Okay, so my top 5 are it's very similar, I suppose. Getting the ear and eyes checked. I'm overdue a visit to the
Opticians.
I don't know what it's the same thing. It's getting your eyes checked, but I don't know what it is in
Okay.
English. I've got the prostate checked. Got that checked 2 years ago.
Fair play.
I think you mentioned that in the very first podcast, if I'm not mistaken, Johnny.
Yeah, it was bizarrely kind of a humble / humiliating /
And
purely pleasant
if I-
experience.
If I recall correctly, was it a German
Italian,
girl, the female? Well, it was Italian. Okay.
Italian doctors. Yeah, so it was like very okay, Mr. Rodan, get your plans down and da 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 da. It was like yeah, I don't know.
Yeah.
It was 8 o'clock in the morning. I just wasn't expecting that accent at me, telling me to get me stuff down and
Yeah,
put this gel
I
on
think
me.
Mike mentioned prostate. You mentioned prostate,
Yeah.
although you're well ahead there. But I mean, it probably should go on the list, no?
I think so as
Yeah.
well. Yeah, must have. So I had sleep problems as well. So we have that. A full checkup. I mean, a proper full checkup, which we'll kind of get into the NCT a little bit later on. But I think that's probably that should be done at least once a year. I think.
Yeah, I recommend anyway.
Yeah, and I think
Yes,
most.
but realistically, is a full checkup kind of like the care NCT? They check 5 or 6 or 7 things.
Well, yeah, blood tests, everything.
Blood tests,
Vital.
heart, prostate.
Weight,
Yeah.
liver function, all this stuff.
What's the gastroenterology thing?
We don't do that here, no.
Yeah, I got a letter in the door 2 weeks ago after I turned 50 saying, please book your appointment now for the.
I think for my birthday in December, I'll treat myself for a prostate exam. What do you think? I shouldn't be laughing, but I haven't got it done. Oh, fuck, I don't know.
I think most GPs want to do a physical exam here until
What you get for
blood
your
test shows
50th?
it. Yeah.
A rubber
Yeah.
glove.
Do you know what? Seeing is if Sean is coming over and we're going to have a kind of a giant up birthday type thing, Aaron, I'll join you.
We'll all do it
Right.
together.
We'll all do it together, yeah. And we'll invite Sean's Italian doctor friend and see if she wants to come for the birthday party as well.
So
Yeah.
at DJ Handsome Pat, as soon as he's set, and I go, where are the three boys? They're out the back.
We might
getting
even
checked.
do it at the birthday party.
Yeah, that's what I'm saying. That's what I'm saying. We do it at the birthday party. Yeah, and I had blood tests as well. So I think full blood tests. I think that's quite important.
So we must have about 6 or 7 at this stage.
we have 7, I think. So we have just the regular checkup with the GP.
Yeah.
As 1, a routine dentist
Yeah.
checkup. 2, checkup on the mental health. 3,
Yeah.
checking out your quality of sleep and if you have sleep apnea or not. I think a lot of people have that and they don't realize it. Checking the prostate, as we mentioned, and doing blood tests. So that's they're all the common ones. We got 4 spaces left. Who wants to have one of theirs? Well, we each get a choice of which one we want to have in for definite. So, Mike, you have physio, getting a recurring pain checked left.
I go to physio.
Physio, okay. But if you go to the physio, it's probably to solve a recurring pain.
Probably is,
Not
yeah.
necessarily, Sean.
Well, after an injury, it would be.
Depends
Why
where
would you
pain
go?
is.
Why would you go to the physio otherwise?
Because my back is killing me.
Oh, yeah, but you could have back problems, or you could have, you know what I mean? Like there's other reasons. Like I know
Yeah,
the
but I
lads
mean-
who run
I
a
mean-
lot will often go directly to a physio because they'll get some injury running that a physio will be able to help them with more
Yeah.
than likely before, say, a doctor will, because a doctor can only prescribe medication or whatever.
Oh, but the doctor would, to go to a physio here, you would have to get the doctor to say,
Not
go to the physio.
necessarily here, as far as I know. Now, I think you pay for it.
Well, you
Maybe
do.
You could have a pain.
through the
You could have a
PHI.
pain in your you could have pain in your Franken beans.
I haven't heard that expression like that. But we say getting a recurring pain check.
Yeah.
I think that would be, that's your choice, Mike. So, if
Yeah,
you wanna-
yeah, okay, yeah, go with that. So, yeah, like you wouldn't be going to the physio with your pain in your left testicle.
You might go with pain the right one.
maybe if you're 50, if your physio is an Italian. Aaron, you've got eye tests, and reading a medical letter properly.
Well, eye test, obviously, because I'm blind since birth. Well, not totally, but I have to wear glasses since I was small, you know, so very important eye test, yeah.
Okay, eye test. Have a good one from one of your better halves about eye testing later on. Niall, you had chiropodists or getting piles treated.
Yeah, I'm going to go with piles, Charlie.
I thought you might.
Well, there's a lot more men than just me, Shawnee. Again, based on the interview that I heard on the radio there recently.
I wonder, is there a podcast on piles?
They call it a dose of the farmer Giles,
Yeah, I'd
don't
say,
they?
again,
Yeah.
it's like my approach to the doctor. I suspect you'd have to throw in 2 or 3 more elements to get a podcast out of it.
Let me see what I had. I pretty much all of mine were already in, actually. Yeah, all mine are were in the top 6 already. So I'm gonna go with Aaron's reading a medical letter properly, because I'm probably a bit like that as well. I usually have to give it to my wife to explain it to my. What am I not understanding here? I think, and I'm horrendously bad when I get a prescription from a doctor and I have to go to the pharmacy, because I'm still going. I'm nervous going into the pharmacy trying to figure out what I'm supposed to get, even though it's written down. And these days they don't even have to print for prescription over here. They just put it in the system, and then you just go to your pharmacy, and then it's there
Just
already.
pick it up, yeah.
Same here, yeah.
So reading a medical letter or prescriptions properly. Okay, we
So-
have our top 10.
Give us the 1 to 10 in no particular order, Shawnee.
So we have just generally going to your GP, regular checkup. We have your routine dentist checkup.
Okay.
Check, having a control on the mental health. I think it's important. I think that would be very high up on things that people ignore.
Yeah,
I think.
counsellors, all of that type of stuff.
Getting the quality of your sleep checked, sleep apnea, every man's favorite prostate checkup. Number 5, general blood tests, recurring pain, not getting that checked, going to the eye doctor. It's checked. After 40, that's there's really something you have to start getting checked out. Like, probably my favorite on the list is getting piles checked. That's something I've never done. And then,
But you don't have piles, Shawnee, do you?
no, I don't have piles.
Well, it would be fairly strange to go into the doctor and say, "Can you look at my piles?" And the doctor goes, "You don't have any piles, Shawnee." And you go, "Gotcha."
Yeah, I got you. That'll be 70 quid.
I enjoyed that checkup all the same. And then reading medical instructions or prescriptions properly. That's our top 10. Now we will, of course, put this top 10 list on at the end of the show on our platforms.
I would think an awful lot of people would have similar top 10s, to be honest.
Yeah.
I would say so. Okay, Mike, you're going to walk us through something that we will kind of call the Irish male health system. What's it all about?
Yeah, so this is the unofficial system that men follow, and not the official one, which involves actually going to a professional and seeking proper advice. But actually, just before I start, there's some interesting stats which are serious stats, to be honest with you. 2 in 5 Irishmen will die before the age of 75 on average, so that's 1 in point something of us here. Cancer is more prevalent in males than it is females, which I was actually shocked
Never knew
Why
that.
that's that. I never knew that. I would have said it's the other way around. In that do get cancer, it's most likely going to be the prostate cancer that we were talking about, or some form of that. It seems to be higher risk. Lifestyle issues, overweight, binge drinking, all that, higher percentages again in that. Preventative care, men are 74.2% less inclined to consult a GP on an annual basis, whereas women are
Staggering,
84.
isn't it?
It is, yeah. I was
Yeah,
actually
it's
shocked
huge.
when I read that. And women are 84%, which I thought was really weird. I thought women were really good to go
Yeah.
to the
Sorry,
GP.
you're saying women are worse.
Are worse than men, seemingly.
I'm shocked with that.
Imagine that.
Yeah.
Maybe it's fake news. I don't know.
Is that just Ireland or is that in general?
Ireland, yeah. No, it's Ireland, yeah.
Okay. yeah.
Jesus Christ.
It's Ireland, so that's interesting. But anyway, so what do we do when we don't want to go and seek professional advice? We'll probably do what? Ignore it, mention it to our wife or partner, ask a friend. Aaron's asking his friends about things there, seemingly, but not us. So I don't know who these
My other
other
group of
friends are.
Sorry.
Mr. Google, you mentioned it earlier, so I think an awful lot of people Google things, and even now with AI, funny feeling people are taking pictures of certain things and uploading it into AI and going, "What is this? And will I die?"
I gotta say, I never Google or ask
You know-
ChatGPT. Never.
Yeah, jeepers.
Don't
Never,
then,
never.
don't start it.
So the thing I had to go see the doctor about was I was fainting or almost fainting fairly regularly for a while. So I'd Googled this, and again I wouldn't just take the first answer. I do a bit of research. So anyway, I can't remember what it's exactly called now. I can't give you the medical thing, but I Googled it and I come to the conclusion that while it was an inconvenience, it wasn't that serious. But Aisling was persistent that it was more serious or it warranted. So anyway, went to the doctor. Even the doctor thought chances are that it was going to be this, but because there are some more significant heart conditions that can also cause these symptoms, I had to go for a series of tests, about like 4 or 5 tests. And as it turns out, the thing that I thought I had from my research, and in fairness to that's what I actually have. Now,
Okay.
that's predominantly a good thing because it's not that serious. So I don't have something seriously wrong. But a part of me still felt a little bit shortchanged that I'd gone for all of these fucking tests and I ended up with the thing that I thought I was going to do.
But
Which is ridiculous.
But obviously you needed to find out what way to treat it, didn't you?
Well, yeah, I don't think there is much that
Is
they
there
can
not?
do by way of treatment. It's not going to kill you or whatever,
Okay. Yeah. Fair point.
Very good. Other things we do, just randomly take painkillers. That's going to fix it. Just take paracetamol, it'll be grand. What I've seen a bit of lately, and I find a bit strange, is people offering other people their prescription drugs. I'm not sleeping well. Oh, the doctor gave me some sleeping tablets. Why don't you
Yeah.
try these?
That's technically called drug dealing, is what that's called.
Maybe that's a Limerick thing more than anything. Yeah.
Yeah, well, prescription, what would have been prescription drugs are a huge problem in terms of drugs nowadays.
Yeah, for sure. Just randomly buying, I suppose you've said they're going into the chemist and just getting over the counter stuff. Like I think part of the problem these days is we don't use our pharmacists enough either, because there is an awful lot of things that can be purchased over the counter that will probably resolve X amount of issues.
Yeah.
Save yourself that 70 or 80 euro to visit to the doctor,
Brilliant. They're brilliant. Yeah.
70 or 80 euro.
Yeah, it is.
Yeah,
To go in the
yeah.
door. Yeah.
60, I think. Is it 60 or 80? Can't remember.
75 was
Was it? Yeah.
And do you guys get any of that back? Can you claim back any of that?
Don't know.
You
Don't know
can.
if
Well, you can self-applied anyway, Shawnee, yeah.
Yeah, I get at the end of the tax bill, but yeah.
You can claim it against your tax, yeah. And my dad basically, so he used to use poachine for both the animals on the farm and himself. So in other words, rubbing poachine, or in some cases drinking poachine, effectively was the cure for virtually every illness.
Did you try that with the piles, Niall?
No, I didn't try it. Probably.
There you go. No, there you go.
I don't think I have poachine there, but yeah. And the other thing that he used to do on occasion was the medication for the cows, which in a lot of cases is the same as human medication. He would also use that on himself, I remember.
Brilliant, isn't
Yeah.
it?
But pochine's good. It's meant to be good for knee pain and stuff like that. Just rub it in, you know.
Yeah, I don't know if there's
Yeah.
much science behind it, Mike, but
No,
yeah,
probably
I
not.
do. Yeah, I mean, definitely, he was a strong believer in poaching as a cure for
It's
virtually
just,
anything.
it's just kind of folklore tales you heard growing up, probably, or something.
Yeah,
Yeah.
But when we go back to what you said, like painkillers and all that, like
Mm.
since I changed my diet 2.5 years ago and more exercise and regular that, like I haven't taken a painkiller or ibuprofen or paracetamol or anything like that since. The only things I take are anti-allergy tablets, like get the allergies around April or May. But I used to have a lot of stomach issues as well. I used to take a lot of Imodium and shit like that. But then since I've changed my diet, like, and cut out stuff that wasn't good for me, basically. I never take
Well,
stuff like
it's,
that.
Fair play.
send us your diet plan. Complaining at work, guys. I don't know who. I don't really complain at work about these things. But seemingly, we'd nearly tell 5 colleagues at work about our problems before we'd actually tell a GP. Don't know, do you find that? But I don't think I'd be
I have
working
one
in
or
the
two.
office.
I have a couple of colleagues listening into this, and I won't say anything. But I do have one. I do know one or two people that complain quite a lot about their
Yeah.
illness.
My rationale, if I'm not going to talk to a doctor about it, I'm not talking to
Yeah.
anyone else about it.
Yeah. You weren't showing anyone your piles now.
Yeah, no, I'm not. I wouldn't be subjecting you guys to my piles now, to be
Okay.
fair.
Fucking I wake up from the middle of a nightmare tonight. There's a
No,
big
w-
Niall
we-
and a
we-
big pile
we-
following him.
We
running
better
after.
push on, Shawnee.
Yeah. So
Yeah.
Niall, the Midlife Man NCT test.
Yeah, so I'm going to do this fairly quickly enough. So basically, if we come up with 5 recommendations that kind of an annual, I suppose, NCT for a man. So 5 things that they should do or should consider doing on a yearly basis based on what we've conversed before. So starting with yourself, Shawnee, your recommendation.
I would definitely do a general GP check.
Okay.
Just go,
Visit
and
the
that
GP.
includes like blood tests and all that they would do. Like,
Okay, so visit to the GP for a kind of an annual once-over checkup, including all of the tests, bloods, etc.
yeah, blood pressure and blood tests and all that. I think that's super important these days.
100%. Aaron, what would you add?
What Sean said, obviously, that would be my first one. Dentist, I know you're going to laugh at me now, but I'm going to have to get this in order. Dentist visit, eye test, fitness check, proper
You
conversation.
won, Aaron. That's 5.
Oh, yeah, but go dentist, so dentist.
Okay, so dentist, annual checkup with the dentist. Mike?
I'd agree with Sean on the GP check because obviously that's, is a professional. Okay. If your teeth are at you, they're just going to fall out. Okay. But I think your GP test, but also fitness, I think, if you're physically fit, I think you're going to probably keep a lot of things at bay too,
Yeah, so go to someone such as, I don't know, a fitness instructor at the gym or get them to analysis of your fitness and give you a program to improve things. I'm good. We haven't said eye test, sure we haven't?
Mm.
And again, to your point earlier on, Shawnee, once you get, and certainly look, I should go more regularly to have my eyes checked. I definitely think that that's important as you get older. So that's 4 guys. So we just need one more for the 5. So what will we add?
I would add a dietitian.
Brilliant, yeah.
Well said.
I would add that. Yeah, it's everything is around what you put in your body
what you put in
and
your
how you
body, yeah.
digest it and all that. And
It's all that, yeah.
dietitian is a big thing, and the foods you eat are the cause of a lot of the issues that you might have. So I would definitely have a dietitian in there, not necessarily to lose weight, but just to eat better.
Yeah, very good.
So we'll publish this obviously with the episode. Again, disclaimer, we're not medical professionals. This isn't medical advice. It's to be taken with a huge grain of salt, so to speak. And this is this is just a conversation to, I suppose, discuss some of those issues. As you can see, certainly if I'm the example, I'm the worst in the world for this stuff. So certainly I'm not preaching to anyone else. Shawnee, you have a quiz.
Yes. Talking about being the worst in the world there, Niall. We have a little quiz. Okay, so I've reached out to your better halves to see what stuff you're actually good at when it comes to the great male checkup avoidance. What stuff you're maybe bad at, and then what stuff that you guys are just completely ugly at when it comes to male checkups. This is the little quiz: the good, the bad, and the ugly of the great male checkup avoidance. I'm just going to read out a statement, and you're going to have to tell me who's.
Okay, so do we have to agree, Shawnee?
Yeah, pretty
can
much.
we
There's not
disagree?
going to be a winner in this, really. It's just going to be more of a consensus.
Okay, so it's one of us, and as a group, we have to decide which one of us is being referred to by this statement.
Precisely. All right, you ready? Okay. And if any of our listeners have been listening intently for the last 43 minutes, you should be able to guess pretty quickly who we're talking about after this statement. So we're going to go with half blind, won't go back and get an eye test.
Niall?
No, Aaron, I'd say.
It's I'm assuming it's either me or
Oh, sorry,
Aaron.
Sean, actually. Shawnee, you said it.
You're not included in this, Shawnee, are you? No?
Out of a balance, I have asked my own wife for her for three as well. I was going to give you those at the end, but we can throw that in. But no, it's not me. Half blind won't go back.
Okay, so it could apply to. So as I say, I'm due an eye test for the last while, so I can. It can be me. I don't know. How are you with eye tests, Aaron? Are you all right with eye tests? I can't.
Fine, I was there a few weeks ago. Yeah. The only thing I wasn't all right was the price of the new glasses. But
And I suspect that's me. Are we all agreed that that's me?
Yeah, I'd say so.
That is you, Niall, yes. You're half blind. You won't even go back and get an eye test. All right, so that was bad. That was bad for
I'm
Niall.
about a third blind. Ashlyn is inclined to. She goes the other direction now, just so you know.
All right, who's bad at taking time off for themselves?
Aaron?
probably have no choice. I have to keep work. Me?
Okay. It could apply to Mike. It could apply to me.
I'm just thinking I have 23 days holidays left to take yet this year, and we're halfway through the year, so it's probably me.
Are you happy to go with Mike, Aaron?
Yeah, we'll go with Mike.
It is Mike. Mike, you're
We're
really
two
bad.
from two, lads.
Very bad at taking time off for yourself. That's bad. Okay. Now, who is... Oh, yes, Aaron. Okay. Okay, what is a big no-no for Aaron? Yeah, he mentioned it earlier. What is one thing he absolutely will not go and get checked up?
You happy with dentist, Mike? He said dentist.
Yeah, I think it's dentist, yeah.
Yes, the dentist is a big no-no.
Three from three.
From three, lads.
Exactly. Okay.
We're good. We're much better at this medical stuff than we give ourselves credit for, lads.
All right. So that was all the bad things about you. Now we'll do the good things about you. Who is actually good at going to the doctor or the dentist if there's an issue?
I'd say you, Shawnee.
It's either you or Mike. It's Mike. Are we happy with Mike?
Yeah.
Mike it is. Mike is quite good at going to the doctor or the dentist if there is an issue.
Well, he said about the drop-in place, so I'm assuming that's part of the solution. Yeah,
I love that drop-in place. It's great.
Who is good at arranging a yearly checkup?
I'm going to guess Sean for this, Aaron.
Who did you say, Niall?
I guess you, Sean, or Mike, or Aaron. Aaron mentioned about doing a yearly checkup, though, in fairness, before, hasn't he?
I did a yearly one last year, but
yeah. Could be me again, because I have a C license, so I have to, every 5 years, I have to do a full medical for that.
Yeah, but this is yearly, he said, so it's not me.
Yearly.
I can tell you that much. I suspect it's either Aaron or Sean. We need to go with one, guys.
Sean's off.
Sean.
It's Aaron.
It's Aaron.
It's Aaron. No,
yeah.
no.
Of course, Aaron is quite good.
Poker there,
Aaron is quite good to arrange a yearly checkup. Okay, so that'd be good for Aaron.
Good.
And we've done the good for Mike. Niall, there was no good comments for you, so we don't have a good. We don't have good. And I'll give you my good one. My good one for my wife is
If
that
Ashley is listening, there was a good comment, and I'm disappointed she didn't mention it.
no, there was no comment, no good comment for you, I'm afraid. But I suppose I did ask what were you kind of not good at, I suppose. And for me, my wife says I'm pretty good at doing sport regularly and fitness and all
Very,
that. So
very fair point. Yeah.
it's good.
Yeah.
Okay, now that was the good, bad, and the ugly. So I'm gonna give a quote, and you're gonna tell me which of your spouse said this quote.
Okay.
You should get this straight off because you already spoke about it. He'll opt for a tooth being pulled out rather than having a filling. I may have to choose food for him later in life.
That's me. That's a true story. The second last time I was at the dentist said we can do whatever, right? And I was like, just take the fucking thing out from there.
Yeah. Okay. And then, the next quote, the ugly. I was really surprised to find out that this next person has never had a prescription in the file with his local chemist.
Sorry, say again, Shawnee?
I was very surprised to find out that this person has never had a prescription filed with a local chemist. So no record of any prescription for one of ye at all in any chemist ever.
No, let's say.
Well, if this, well, no, sure, I'm gone. It can't be me.
Me, I'd say.
Can it be me again?
It's me, I'd say, is it?
Is it you, Aaron?
Well, it could be because I'm.
Well,
Always
have you got a
tried.
second prescription in the chemist recently, Aaron?
No.
Mike?
I have.
Aaron. It's Aaron then.
It is Aaron. Aaron has never had a prescription on file at his local chemist.
No. There you go.
That's better.
It's signed.
It's the little things that.
All right, which kind of is the next one between myself and Mike. Very much likes to do a self-diagnose, particularly when it comes to man flu, and brings home loads of medication. On average, on average, once a month. Once a month.
I suspect that's Mike. Aaron? Or Sean?
Yeah, it's Mike. It's Mike.
Mike, yeah.
Man flu once a month. No,
I think I had a dose for just kills 9 out of 10 men, you know.
I think the humidity is very high today. Go on.
It's a running joke here in the household, you know.
Just for a bit of balance, then my own wife says, okay, I'm good at doing sports regularly, which you said. I'm bad at going for checkups, and if I have to call or make an appointment, I would never go. So I do the dentist on an annual basis, but because I've gone once, I book a year in advance. So it's done, and then we have it in the calendar and all that. But I'm terrible about making appointments, and I'm also on the man flu list, Mike. And my wife says, I remember when you had a really sore throat a couple of years ago, and you weren't able to even get up and get some water. And she wants to figure out what's the correlation between a sore throat and your legs not working.
That's harsh.
It's a reasonable point, to be fair to her.
To be fair, yeah, it is. It is. I gotta say, when I have man flu, I just fucking I lie in bed and I do nothing. Nothing functions or works until it's over. So I'm pretty bad at that. That was quite fun. But I think we did say at the start of this, this is a competition. Which one of us would win the Great Male Check-Up Avoidance Award? I think Niall, you have to be a winner there.
Yeah.
I agree.
Yeah.
Yeah, I agree. Yeah.
Ironically, winner in inverted commas there to a certain degree, but however.
Exactly. So, so I guess the message from Friends in Low Places is don't put off what you could should be getting checked up at this stage of your life. Which leaves me with a quote from the great Benjamin Franklin, which is quite fitting given that this weekend is the 4th of July in the States. An ounce of prevention is worth a pound of cure. So let that sink in and think about it. But that's it from this episode of Friends in Low Places. Thanks for tuning in.
Well done.
Bye for
Thanks,
me.
guys.
Folks.
Bye, folks. Thank you.
Bye-bye.
Good luck
All
and
right,
thank
be
you.
good. Take care. Ciao, ciao. I've lost me mouse. That's I can't stop.
Suppose a ride is out of the question.
Down with this sort of thing. Careful now.